A lot of women have been calling Jyzen lately, asking for help with their hormones. I think this is because of the data that's come out in the last year showing that using hormones in menopause is absolutely safe and will protect you against dying from various diseases. All-cause mortality is reduced in women that use hormones. There was also a really powerful study that came out about the benefits of using hormones for brain function, and that it reduces your risk for Alzheimer's using hormones after menopause. So I've been doing bioidentical hormone balancing since 1998. And what I've found is that when women are going into perimenopause and then menopause, they often have hot flashes, night sweats, difficulty sleeping, changes with their mood, changes with their memory, trouble with word finding, word substitutions. Their sex drive goes down. They start having other types of sexual dysfunction like vaginal dryness, difficulty reaching orgasms. They may be more prone to urinary tract infections. They may be more fatigued. They may have more body pain because hormones are anti-inflammatory. So they might have joint pain, muscle pain. And if they have a previous autoimmune disorder, it may get worse. A lot of women end up with gut problems. They end up with hair loss, acne for the first time in their lives, or at least since they were a teenager. So there's a lot of symptoms women can have that can be fully alleviated by getting onto hormones. So what do we do here at Jyzen? Because it's not just me, it's all the doctors at Jyzen do bioidentical hormone balancing for women and for men, which we'll cover in a different video. But what we do is we start by taking a thorough history and taking a look at what they're experiencing, doing thorough blood testing, because it's important to look at the entire hormonal milieu. And a lot of doctors will only supplement estrogen and then progesterone in a woman if she has a uterus, but they ignore everything else. And what I have found over all these 26 years of medical practice, 27 years, is that you can use lower doses of any one hormone if you're paying attention to the balance of all of them, because they all shift and change at the time of perimenopause and then menopause. So it's critical to look not only at estradiol and progesterone, but to look at testosterone, to look at the adrenal hormones, cortisol, DHEA, and pregnenolone, and then carefully look at the thyroid, because perimenopause and menopause is a time in a woman's life where the thyroid can dysregulate. So if you're not looking at all of these hormones, you may be trying to overcompensate by oversupplementing one hormone to compensate for a deficiency of another. So it's critical to look at the whole milieu and supplement accordingly, and to remember that our endocrine system is a delicate balance, and there's no need to be heavy-handed with any one hormone. It's best to be subtle and to use the lowest possible dose needed of all of them in the appropriate balance. And then what happens? Oftentimes, women will start sleeping better, their mood improves, their memory turns around on a dime. If their hair has been falling out, at least it starts to taper off and eventually regrow in most cases. It can have beneficial effects on all those areas I mentioned. Their pain levels reduce, their gut problems can get better. Even autoimmune problems can become easier to control again. So, highly recommend that you look into whether you're a candidate for using bioidentical hormones and see a doctor at Jyzen, because we all know how to do this and do it really well.